Lawndale is a Christian health center on the west side of Chicago. We are sort of based on Ogden Avenue, but we have 5 different sites on the west side. We additionally serve at 11 shelters in the city and 11 more temporary shelters.
My name's Alexander Port. I'm a family medicine physician and I'm the site medical director at Pacific Garden Mission. The main job role is I see patients here. So we have a primary care clinic set on site here at the shelter, and we have a provider here 5 days a week. The work that I'm doing, to me, does not make any sense without faith. To take a job where you're paid less, doing harder work, it all comes from how I see Christ's sense of justice, in that Old Testament justice is always paired with how you treat the poor. Recognizing that God really cares about this deeply, and as someone who has a lot, that there's responsibility there. 3 years ago, I was coming in here pretty much by myself with a suitcase full of meds and one medical assistant. Felt pretty isolating, and we see a lot of people with a lot of challenges, and you carry that as a physician, and that can wear on you. And here at the shelter, we see a lot of people who have severe mental illness, things like schizophrenia and bipolar that traditionally for a primary care doctor are pretty difficult to manage.
Since you've been here, okay. So they connected us together. So I'm a psychiatrist.
Okay.
Have you ever seen psychiatrists before?
I need one.
You need one. Okay, well then hopefully we can figure something out together.
God is good.
God, he sure is. He sure is.
Changes that happened from having psychiatry on site were pretty drastic right away.
Behavioral health is very much needed in all shelters because sometimes people are unstable and they need to get back to themselves, and Dr. O is the person to get them back there. I call her the gentle giant, so it's just one of those things. It's like if I was to ever want to see somebody or speak to somebody, it would be her. And I always tell patients that when you leave her, you're going to feel 10 times better. You're going to feel whole again.
Going into the shelters was an experience that I really believe was, I don't know how to put it. It almost highlighted and brought to surface, like, man, God is bringing you to Lawndale to do this work as a psychiatrist, but now God is bringing you into shelters. I still remember when I got that call from Detmer. This was October, so I started Lawndale October of 2020. So we're sort of like in the height of COVID. I was still home. I was transitioning and doing telehealth from home is how the job description was to start. And I got a call from him a few weeks, and he said, we have a need. And I want you to think about this, and I want you to talk to Mike about this, my husband. We are really noticing and recognizing that there are a lot of people that we are serving who are experiencing homelessness, who have significant psychiatric needs, and we don't know how to manage them. And the ask was essentially, would you consider coming into our shelters to deliver psychiatric care? Now, at this point, we've been in our COVID bubble. I had a newborn, or I was pregnant. No, I was pregnant at the time. He knew what he was asking me, right? Because now he's asking, come in with your pregnancy into these shelters of all spaces, which are carrying all sorts of risks and uncertainties about health, to be able to provide psychiatric care. And so I just simply said, okay, let me talk to Mike about it, which that's always kind of my cop-out when I'm like, I don't know if I really want to do this. Let me just say I have to talk to my husband. And so that's what I did. I said, let me talk to Mike about it. And I knew I was going to hang up the phone and talk to Mike, and he was going to be like, there's no way that you're going to go in there in your state to do this work. And so I talked to Mike, and to my surprise, he looked back at me and he said, well, do you want to do it? And there was a piece of me that did. There was also a piece of me that thought that was kind of crazy. I wish I could say I was drawn because I wanted to help the people so much. Really, I think I said yes in a dutiful way, I care about Detmer. Detmer needs me to do this. The team needs this. I'm going to do it. I'm going to do it for the team is how I went in. And today I can truly say that working in the shelters is probably one of my favorite parts of the jobs that I do, but it also serves as some of the most meaningful work that I do. This work that I do, both as a psychiatrist and in the capacity that I do it, drops me down to my knees every single time because I don't actually feel particularly equipped to do that kind of work.
Some people call it incarnational work. It's the idea that drawing near to the people who are suffering so that we can not only embrace that, but we can walk alongside people in that is really, really important. And to have a team of folks who can come into a space and be proximate with people in the space where they're living is really spectacular. I like to say that I've been at Lawndale now for 25 years, and for the first 20 years, I'm pretty sure that I had had exactly 0 meetings with people at the Chicago Department of Public Health. That all changed during the pandemic, and at times we were having meetings 2 or 3 times every day. And what that experience taught us, and it taught me, is that we can do far more good working together than we can independently.
Our team has grown in that short time span of 3 years, and physicians working at other shelter sites are much more connected. When you feel like you're in it together, the stories of what you're going through doesn't feel as singular. It feels like, oh, you've gone through that too.
And I always want to speak life into people. And then my team does the same thing to me. Some days we all have our moments where we have to be picked up again. You know, we run short sometimes, of course. I always tell my boss, this job is not for the weak and weary. You gotta have faith in everything that you do.
I serve a God who can contain my anger, my frustration, and I don't have to pretend that, you know, I'm happy with the things or I'm okay with the things that are happening. I can purely be unhappy, and his love is big enough to contain that. And so I think about my work as a psychiatrist really has helped me understand that I serve a God who can contain all of it.